Here you can see this is the gluteal region. So an incision has been given along the iliac crest. Here this bony landmark is the posterior superior iliac spine, and here we have the sacroiliac joint. So we have cut the skin along the midline till the natal cleft. Then the incision was taken along the gluteal fold. Finally, it extended laterally till the iliotibial tract, and another incision was given vertically downwards. So after all these incisions, the skin of the gluteal region, it was reflected. The superficial fascia had large amount of fat, and that is for we sit on this region over the buttocks. Now after removing those superficial fascia and deep fascia, you can see this huge muscle having a vast origin. This is the gluteus maximus. So origin, you can see it takes place from the outer part of the ilium or the iliac part of the hip bone, posterior to the posterior gluteal line. It is taking origin along this iliac crest, then along the lateral border of the posterior aspect of the sacrum, the coccyx, and finally in this aspect the origin is from the ligament which extends from the sacrum to the gluteal tuberosity. That ligament is known as the sacrotuberous ligament. So you can see those fibers also coming. All these fibers, they run downwards laterally and they insert onto this thick fibrous band, which you can see. This thick fibrous band, here also you can see, that is the iliotibial tract. So 3/4 of this huge muscle, it is going to insert onto the iliotibial tract. Whereas only 1/4 of the muscle fibers, they go and insert onto the gluteal tuberosity, which is found on the femur. Alright, so now we have given a midline incision and opened up the gluteus maximus to see the structures beneath it. So as I reflect this large fan-shaped muscle, you can see the different structures beneath it. Starting from above, you have the gluteus medius muscle. This large fan-shaped muscle, this is the gluteus medius. So this is having origin anterior to the posterior gluteal line till the anterior gluteal line, which is present on the outer surface of the iliac bone. And where it is going to insert? See, it is going to insert onto this side. Here you have the greater trochanter. So it is going to insert onto the lateral aspect of the greater trochanter. Beneath that, so I have reflected, cut the gluteus medius along its origin, and as I reflect, you can see another muscle beneath that. So this muscle is the gluteus minimus. So these are the three large fan-shaped muscles. So now I have reflected the gluteus maximus. We have seen there two other gluteal muscles, that is the medius and beneath that the minimus. So minimus, it is originating below the inferior gluteal line. It originates below the inferior gluteal line. So this is the gluteus minimus. Now beneath that you can see this muscle, which is known as the key muscle of the gluteal region. This is the piriformis muscle. So structures coming above it have been referred to as the superior gluteal nerves and vessels. Inferior to that, inferior gluteal nerves and vessels. So here at the upper border, so here at the upper border of the piriformis, you can see certain blood vessels. So here you can see certain blood vessels coming. So superior gluteal vessels and nerves will be present at the upper border, whereas in the inferior border, you can find the inferior gluteal nerve. Here, this is the inferior gluteal nerve. We know the gluteus maximus, it is supplied by the inferior gluteal nerve. So here you can see these nerve fibers innervating this huge muscle. These are the inferior gluteal nerve. Apart from that, what else you can see? You can see this huge nerve coming from the inferior border of the piriformis. So this is the sciatic nerve. The sciatic nerve, it has two components, common peroneal and the tibial nerve. Now beneath that you can see these muscles. Here two muscles, and in between you have a tendon, a thick tendon in between these two muscles. So these are the superior and inferior gemellus, and in between you have the tendon of the obturator internus. And beneath, if you go down, that will be the site of the muscle known as the quadratus femoris. So here you can see the muscle which is gluteus maximus. We have divided the gluteus maximus, and upon reflecting it, we can find the various structures under its cover. So if we look under, the first muscle was the gluteus medius. Beneath the gluteus medius, we have another small fan-shaped muscle. This is the gluteus minimus. Now this muscle, this is known as the piriformis. It is the key muscle of the gluteal region. Now the structures passing above it are the superior gluteal blood vessels and the superior gluteal nerve. So we have the superior gluteal blood vessel and the superior gluteal nerve at this position. Then along the inferior border, we have this large nerve coming out. This is the sciatic nerve. We have the inferior gluteal nerve which comes, and all these branches are given to supply the gluteus maximus. Apart from that, we have the three important structures known as the pin structures. So here you can see the three important structures, the known as the pin structures. These are the nerve to obturator internus. This is the internal of pudendal vessels, and here you can see this is the pudendal nerve. So pudendal nerve, internal pudendal vessels, and the nerve to obturator internus. Coming below, you can see these are the three muscles: the superior gemellus, inferior gemellus, and in between you have the tendon of the obturator internus. Coming to this muscle below, here you have the quadratus femoris muscle. Now students, this bony prominence is the ischial tuberosity. From here we will have the origin of the muscles of the posterior compartment of thigh. So here you can see the groups of muscle originating from this ischial tuberosity are known as the hamstring muscles.